Hello everyone, I am Dr. Kartheek, consultant orthopedic surgeon at Care Hospitals Malakpet. Today we will be discussing about foot deformities in rheumatoid arthritis patients specifically. Of course, these type of deformities happen in other patients who are not suffering from the rheumatoid arthritis also, but these are more common in rheumatoid arthritis patients. Most of the times, these happen in patients who are suffering from severe rheumatoid arthritis, so they will be under follow-up with the rheumatologist, and these develop over a course of time, like taking 5 to 6 years to develop and manifest significantly. So they think that they are process of the aging, but most commonly these deformities like hallux valgus, hammer toe deformities or windswept deformities, these happen in such a way that there will be a gross deviation of the toes, and the patients will likely lose balance when they are walking casually or on uneven ground to sustain fractures or other injuries. So, whenever they notice some changes in their shape of their foot or they feel difficulty in walking on uneven ground, it's they should follow up with an orthopedic surgeon in addition to the rheumatologist, so that they get evaluated for their foot deformities. And these foot deformities, with the advanced technology available right now, can be corrected with the splints and sometimes requiring surgery. The main thing is, in the old days, these foot deformities, if neglected, they will lead to the disturbance in their gait or leading to fall, mainly in the washrooms when they walk on the watery and or slippery surface, sustaining other injuries. So, and now these foot deformities can be corrected with the help of the surgeries available nowadays.